So this one is coming up in a couple weeks, keeping kids healthy this school year. It looks specifically like they're going to be talking a lot about vaccines and some other COVID-19 protections as things kind of evolve this school year. So those are just a couple opportunities coming up we wanted to share with you. All right, here's our COVID update. So we're still low, still high in terms of our transmission rate. I'll go ahead and talk a little bit. I know last week there was some questions kind of confusing, like why can the community level be low, but our transmission rate be high? And so I'll explain a little bit, but really it has to do with our case rate and then our test positivity rate. And so those numbers are there for you to see. We're also trying to continue to report out on our vaccine rates, now including boosters. The CDC currently isn't tracking those second boosters. That data isn't available on their dashboard. But once they do, we'll be reporting out on that as well. CDC will continue to update their information on Thursday afternoons. I've heard this may change in the next couple of weeks to Wednesdays, which will be convenient for us because then on these calls we'll have more updated information for you all. Here's our map. Our region is looking nice and solid green over here, so we're seeing still low community levels. And how these levels are determined. So our case rate right now is around 76. And how that plays into our transmission. So you'll see that the map is quite red and Pima County is still showing a high transmission level. And so the two data points that determine the transmission level are the case rate as well as the test positivity rate. And so when cases are below 100 per 100,000, that would move us out of a high transmission rate. But because our test positivity is still around 13%, that still puts us in that high category. If our test positivity rate can dip below that 10%, then hopefully we'll see Pima County turning to orange. The percent positivity rate, I mean, the accuracy of that number is debatable. That's why it's really important for folks to continue to report their home tests. And so we're really encouraging everyone to report their results from their over-the-counter tests.
No me acordaba hasta que vi el récord. Ándale, pues, ya con el favor de Dios nos
Hold
vemos.
on, we're going to go ahead and mute folks' mics here. Thanks. If your school is distributing those over-the-counter tests for families to take home, please just send a note to remind them that we really appreciate if they can report those test results. And before we talk about the talking points, I'm actually going to stop sharing and invite Mariana. She is on the call to give more of a situational update on monkeypox.
Okay, well, thank you. Good morning. Let me, as usual, try to share.
Might have to give you quick permission, Mariana.
Yeah,
give me
you will.
Second.
Yeah. The share is not. Yeah, now I can do. Okay. So here we are to talk about monkeypox today. Usually the numbers are not really big. So this week in epidemiological weeks is week 39. This week goes from last Sunday, that was the 25th, and of September to, guess what, October 1st. It's incredible how the time goes by. So far we have 111 monkeypox cases reported. From those that we have investigated, we have 32 confirmed and 23 probable. That give us 55 cases of monkeypox that you will see in our website for today. We have 2 suspected. That means that they have been tested and we're waiting for results. And 54 of all of these had been already negative, classified as not a case. And I like to show this because the gray areas that are not a case let us know how many people has been tested. So week 33 was the weekend of Labor Day. So 2 to 3 weeks after, we saw an increase in testing. What is good because, as I commented before, means that the providers are asking for the risk and are trying to do their best to detect the cases. So, and these two blue here are the two for this week that we still don't know. So our epi curve that show us the number of cases and how we have the first case and then we were increasing. It looks like our peak was in week 32. That was the last week of August. And now we're going down, not as down as we would like to, was to still have some cases in the community, but definitely we are much better than other counties and other states. And for our news for this week, still no school-age monkeypox cases in Pima County. And the vaccination efforts in Pima County is not that they stop, but they're going to change from the big pods that we were doing for 6 Saturdays in a row. That last big vaccination pod at Abrams was last Saturday on the 24th. And this is going to change because CDC just opened eligibility for the pre-exposure prophylaxis vaccination. And so we are working on adequate our response. Meanwhile, the people that needs the second dose or that wants to be vaccinated still with the past eligibility, they can go to our clinics. But now we will offer vaccination to a new eligible group pre-exposure. CDC yesterday said that according to the data that they have collected with the post-exposed prophylaxis, they see that a person that is vaccinated has a person that is not vaccinated has 14 times more probability to get the disease compared with a person that has been vaccinated. Even though this vaccine is not 100% protective, that's a huge protection if you think about it. So they open to kind of the same idea of a lot of increased number of sexual partners and somebody that has the diagnosis of an STI, any other STI, sexual transmitted infection, and people that we were not vaccinating, people that their partners have high risk factor, but they don't. So now it's open to all of that. And the other thing that changed is the time. The time period before was 14 days before the day that you're asking for the vaccine. Now it's going to be 6 months. So this is going to be a big change. And all this we're able to do it because of that change that the vaccine now is not intramuscular, it's intradermal. So there is more availability of vaccines. And as usual, this is the TEPI team contact information. And I'm going to stop presenting and pass it to Matt because the talking points are super important and we can discuss after if somebody has a question. Did I do it? Did I pass it to you? Yes.
You did. Thanks,
Yes.
Mariana.
Woohoo.
All right, let me go find that slide. All right, so we received a few requests that it would be helpful just to know how to, talk to the community about monkeypox. These aren't necessarily school specific, but this is what's being communicated out through our department. And so I'm just going to go over these really quickly, and then we'll be happy to take questions. So monkeypox, it's a virus that has not occurred naturally in the US, but is causing a current outbreak. It is spread primarily by direct skin-to-skin contact with an infected person, or contact with their bedding or unwashed clothing, sex, or living with an infected person. It may also spread via respiratory secretions through face-to-face interaction. And this is the type that mainly happen when living or caring for an infected person. A rash or sores can appear sometimes on or near the genitals, but they may be on the hands, feet, or face, or inside the body, including the mouth, anus, or vagina. Flu-like symptoms may also occur, but some may only get the rash. People seeking testing for monkeypox must consult with their healthcare provider, and people infected with the virus should isolate from others in their household if possible and avoid contact with pets. People who are known to have been exposed or believe that they're at very high risk for exposure can fill out a Pima County monkeypox vaccination interest form that is linked here, or they can go online to our website and check to see if they're eligible for any of our vaccination opportunities. Our EPI contact information is here. That is intended for healthcare providers. That includes you on the call. If you have parents who want to contact the health department, please just have them contact the main number here at the health department. But for any healthcare providers or school health staff, you're welcome to call the EPI number if you have questions. And then you're always welcome to direct people to pima.gov/monkeypox. That's kind of our current hub for all of the monkeypox information. It also includes the updated numbers for positive cases that we're seeing here in Pima County. So we hope this will be helpful as things evolve and more information comes out. These talking points might be updated, and if they are, then we'll be sure to communicate that to all of you as well. Before we take questions, I just want to let you know our resource slide. I have updated our test kit request form. There's a new survey. It's very similar to the one you're all familiar with. There are plenty of take-home test kits available. So if your school would like to help distribute those out to families, especially as we approach fall break and events like homecoming and things like that, we have plenty of test kits that we're happy to provide. And then we also have our monkeypox information, links to all that information here as well. If you need to get a hold of me or the schools team, you're always welcome to email schoolsupport@pima.gov. You can also call and leave a message, but quickest response is probably going to be through email. And then we have a lot of great resources as well on the pima.gov/healthyschools. So that's all I have. Be happy to take questions. It looks like one chat did come through. Mariana, can you talk about how pets are involved when it comes to monkeypox?
It's really interesting how pets are involved. First of all, monkeypox is a zoonotic disease. That means that somehow it came, the reservoir is animals. And it's called monkeypox because it was first identified in a group of monkeys in a lab. It doesn't mean that it's come from a monkeypox. That's a bad thing. There are suspicions that the human can transmit to pet. Exactly the question. The question is, how are pets involved? Can monkeypox be transmitted from human to pet? Actually, the answer is yes. And there is at least one article in the known literature in France. They detected monkeypox in a dog at home. So we are prepared to, if we have any kind of inquiry, being able to test the dog with the help of the veterinarian, because so far I have not assisted with pets to pet school. But that's the main thing that we could, if a person that has monkeypox could transmit it to their pet. And this strain, it's a little bit different to the wild strains that has been circulating in Africa. Actually, this one, it looks like could be easier to give to the pets. Okay. Though it says since mouth, hand, and foot disease is also going around, that's the way that this presents different from monkeypox. Yes, so mouth, hand, foot, and mouth, it's usually in the hand, foot, and mouth. That's kind of the first thing. They have fever before, and then they have these vesicles that inside the mouth can be looking like a blister, and you can see them in the mucosa. You will not see crusts. You will always see like a white lesion, and that's because it's trying to heal. So it doesn't have the lesions in mouth, around the mouth, and the hands and in the foot. They are usually vesicles, and they do not crust like the monkeypox. So also a big difference is the kind of the virus is different, and the age of presentation is different. So with monkeypox, we're all the time trying to look for the epidemiological link to somebody, some exposed, and then we're going to test. So kind of that's kind of the difference. Are those lesions usually painful in hand, foot, and mouth? They are for the kids. Yes, they're very annoying. They're painful and they're itching, and especially for eating. It's a big problem when it's on really babies that are only breastfeeding or only using a bottle, because the way that they suck will kind of scratch those lesions all the time, and they're very fussy and they're very uncomfortable. So yes, and in the case of monkeypox, the lesions are itching and super painful.
Thank you for those questions. If anyone else has questions, you're welcome to attempt the chat. If not, we'd invite folks to raise their hand and unmute and ask their question. Looks like there one just popped up in the chat, Mariana, from Kathy.
Yeah, the question is, rather than have school staff health offices try to determine hand, foot, and mouth versus monkeypox, would you recommend students presenting be sent to provider? Absolutely. You are not the person that is responsible for the diagnosis. The only thing that you will maybe help with is kind of, if this kid is in a classroom where you already have seen 3 or 4 cases of hand, foot, and mouth, it's kind of a little bit obvious, but that it could be that. So just send them to the doctor, to their health provider, and ask them to come back with a note. Oh, I remember we discussed the presentation about the rash. We did it with the Vail. I did it with the Vail school district. It ended being long because it's typical of the rash. It's impossible to summarize. It ended being like an hour, but I believe it was helpful. So we discussed that if anybody wants to a special thing, please communicate with Matt, and he will let me know.
And just to clarify, Mariana, that is a 1-hour presentation reviewing the different types of rashes and how they present and how they might be different from monkeypox.
Yes. So what I did was a review of anything that you could see as skin lesions, very frequent, beginning for what is not even infectious disease, like a burn or medications or things like that. And then we went through the most common bacterial, virals, and fungals. Usually the virals are the big problems. So kind of showing photos and saying the contagious period, this and that. So a little bit helpful, hopefully, for the nurses.
Great. Yes, of course. If anyone would like that presentation for their staff, go ahead and send a message to schoolsupport@pima.gov, and we'll begin coordinating that for you. Thanks, Mariana. Are there any other questions today? Well, if not now, you're always welcome to ask those throughout the week. You don't have to wait until next Thursday. Oh, I spoke too soon. Was it recorded, the rash presentation?
Yes, it was. And I just finished solving that problem, somebody from the IT on the school sent me a Dropbox, and that was the way to share it easier. And Chris knows who that person is, and will take care of sharing around at the school district.
Great. So it sounds like that's another option too. As far as the rapid tests available, yes, the link to request those rapid tests will be in the slide deck and the follow-up email. So you can submit a request and then those will be available for pickup from our warehouse. All right. Well, I want to thank everybody for joining us today. We sure do appreciate everything that you all do. Shout out to Mariana for joining us and providing great information. I hope everyone has a great rest of your week, and we'll see you again next Thursday. Thank you,
Bye.
everyone.